here to tell us how to protect you and your kids from bites and infections is pediatrician Dr. Dina Kulik. Hello.
Hello.
Good to see you.
You too.
All right, please tell us, is there really a way that we can prevent mosquito bites?
Sure,
These
for
things
sure.
are so pesky. Dina.
So annoying, so itchy, keeps you up at night. Absolutely. Lots of easy tricks. So starting with your clothing. So wearing long sleeve shirts, light colored is key. Long pants, doing the very sexy trick of tucking your pant leg into your sock so they can't get up inside your pant leg. It doesn't look so great, but it works quite well. For younger kids, especially using bug netting, so putting this kind of fine mesh on top of strollers, on top of car seats, bassinets.
Okay, can I stop you for just a second? Because I thought that was sort of interesting. You said light clothing. Like mosquitoes can see colors and they're attracted to darker colors?
Ticks also are less likely to bite you if you're wearing light colored. So white, gray, those kind of colors, nothing bright.
The tucking in is kind of also mandatory for ticks, right? Because that's where they usually get you.
They come right up inside your pant leg, for sure.
So, and we know, like, not to fearmonger, but like we've been hearing about Lyme disease. Avril Lavigne has been suffering from it and can be really serious.
Sure.
So that comes from a tick.
It does, yeah.
And how bad is the problem? I don't know if we know this year, but also what is the treatment or anything that is going to happen after?
For sure. So ticks, there are deer ticks in particular. So dog ticks, much more common, especially around in Canada. But deer ticks harbor ticks that have Lyme disease, potentially have Lyme disease, and those bite you and they live on your skin and they take your blood and also inject you with that bacteria. So about 75% of people will then get some kind of rash. It looks like a target lesion, we call it, called erythema migrans. Red, then a circular level of skin color, and then red in the center as well. You might find that on the child's body or your body. It's not itchy, it's not painful, so it's hard to detect really. And those kids would then, or adults, would then get tested for Lyme disease, and the treatment is 2 to 3 weeks of antibiotics orally.
All right, so there's some serious health implications here beyond just the regular itching from mosquitoes.
Sure,
what else have you brought here for us to help us prevent getting bit?
So protecting, again, from a barrier perspective, so using a very fine mesh on top of gazebos that you're using, or strollers, or car seats. Similarly, this type also protects against the sun, but also blocks the mosquitoes and ticks from coming inside. And then, of course, bug sprays, bug lotions, wipes, there's lots of options. For kids older than the age of 6 months, you can use one with DEET inside, so 10% concentration of DEET or less. And what you do is you just look on the side, it'll say this one's 7%. You don't want to apply it to your child's face or their hands. You want to do it for your child, of course, so that they don't get it in their face or ingest it. So you just apply it to your hands or spray it on them, rub it in, nothing on the face.
What about citronella? Does that work? I've heard that, and I've tried that citronella candles, but it seems like I'm still getting bit.
Unfortunately, it doesn't work well, actually. So citronella, eucalyptus oil, those kind of products don't actually work very well, and they can be toxic to kids. So best bet is use a DEET-containing product. Again, kids older than 6 months can use that. Kids younger than 6 months, you want to use the barrier protection.
So you feel this is comfortable. Is there like a non-toxic option?
So they're not toxic as long as they're not ingested.
Okay.
So unfortunately, citronella and eucalyptus oil can actually be more toxic than DEET. As long as this isn't ingested or inhaled, it's actually very safe for kids.
Dr. Dina Kulik, she's a pediatrician. Thank you so much.
Thanks for having me.